Pryna'n da. Good afternoon, everybody. I'm Dr. Frank Atherton. I'm the Chief Medical Officer for Wales.
And I'm Andrew Goodall, Chief Executive of NHS Wales. Today, Frank will give you an overview of the latest situation in Wales, and I will update you about the impact on the NHS in Wales. Frank.
Yeah, thanks very much, Andrew. It'll come as no surprise to everybody to know that the situation in Wales is very serious at the moment. We're seeing cases of coronavirus in all parts of Wales in very high rates. The 7-day average at the moment is around about 480 per 100,000, which is way too high. And there are signs that it's rising in many parts of the country still, particularly in North Wales, where we're seeing quite rapid increases in Wrexham, in Flintshire and in Denbighshire. There are two real reasons for this. One is for too much population mixing, but the other one is, of course, that there is a new variant strain, and I'll talk a little bit more about that in a moment. But just a couple of indicators of the severity. About 1 in 4 of all the coronavirus tests that we do in Wales at the moment are coming back as positive. So this shows that there's a lot of, it's very widespread in terms of transmission in our communities. Also, and this particularly concerns me, we are seeing rises in the rates in the over 60s part of our population. And of course, we know that matters because that leads to more severe infection, to hospitalisation. And we'll talk about the pressures on the health service. Andrew will talk about that in a moment. So in the week before Christmas, we learned about the new variant, which was identified in parts of England, down in London and the southeast of England, and has subsequently appeared in the north and south of Wales. And this new strain, as we've come to learn, is more infectious than the previous strain, which we were familiar with here in the UK. So as we saw the number of cases escalating rapidly, partly as a result of the new variant, as we saw that happening before Christmas, of course, we in Wales moved into our level 4 lockdown arrangements. We continue to learn more about the strain, but it does spread very rapidly. In fact, in London and the southeast, in a space of about 3 weeks, it went from being 25% of the viruses that were being identified with a new variant to around about well over 90-95%. So it moves very quickly, and we believe that there's a similar trajectory of the new variant here in Wales as well. In fact, there's a slide, and we could have a quick look at that maybe. There should be 2 maps that you can see, and the slide on the left, the first slide, just shows where we were with the new variant as of December the 7th. And the red dots are cases of new variant that were identified. And then the second map over on the right shows the same picture, but it was just after Christmas. So it shows how rapidly the spread can be of the new variant. It also really demonstrates quite significantly that the clustering that we have in northeast Wales and down in the south of Wales. So there is a clustering effect, but we do expect the new variant to spread to all parts of Wales. Thank you. So luckily, one good thing about the new variant is we don't believe, on current evidence, that it causes a more serious illness. We're really worried about it because it's so infectious. It spreads so easily from person to person. So even with the restrictions that have been in place across the various nations of the UK, the new strain is still driving its way through the population. And that's why we believe we've been seeing the increase in hospitalisations and severe cases of severe disease across the UK. And that's really one of the reasons why, as Chief Medical Officers, myself and my colleagues across England, Scotland and Northern Ireland earlier this week announced the move to the highest level of UK risk level, level 5. We made that announcement on Monday this week. At the start of this week, we got information from the Joint Biosecurity Centre, which is a UK construct, and it gave us data about where coronavirus was spreading in the UK and about the hospitalisation rates. And it was the fact that the health service was under such pressure. So level 5 essentially means that the health service, its ability to manage further increases in coronavirus cases without becoming overwhelmed within 21-day period was really under threat. And that was what provoked us to make that decision around the threat level. I think I'll do probably best now if I just hand over to Andrew and he just explains the pressures and the impact that this is having on the NHS here in Wales. Thanks, Andrew.
Thank you, Frank. Diolch. Our experience throughout the pandemic has been that high levels of cases in the community leads to more hospital admissions, more seriously ill patients, and ultimately to more deaths, sadly. When someone is admitted to hospital with coronavirus, they are likely to stay much longer than a typical emergency admission. Around half of coronavirus patients will be in hospital for more than 2 weeks, and a quarter for more than 3 weeks. This means beds are occupied for longer, while more people are being admitted for treatment every day. We have 4 levels of escalation in the NHS, which reflects the pressures in the system. Today, there are 16 hospitals reporting levels 3 or 4, the 2 highest levels of pressure. 6 hospitals are at level 4. The NHS is working very hard to balance winter and emergency pressures with the demands of looking after increasing numbers of people who are seriously ill with coronavirus. The NHS is very challenged at the moment and faces a difficult period ahead. This is always the most challenging time of the year, but the pandemic pressures means this is even more intense as a period for the health and the care system. The number of people admitted to hospital with coronavirus symptoms has continued to rise over the last 2 weeks. There are now almost 2,800 COVID-related patients in Welsh hospitals. This is 4% higher than the same point last week, and it represents the highest number on record. If this trend continues, very soon the number of coronavirus-related patients in hospital will be twice the peak we saw during the first wave in April. More than a third of hospital beds are occupied by COVID-related patients. This varies across Wales and is close to 50% in 2 health boards. This has a significant impact on their ability to deliver local services. There are 140 people currently in critical care with coronavirus. This is the highest we have seen during the second wave. Intensive care units are under enormous pressure at the moment. Our critical care capacity is operating at almost 140% of its normal occupancy. We can expand beds further, but this means that other clinical services are disrupted as we move into other clinical areas. We are not able to deliver a complete range of NHS services with such high rates of coronavirus in our communities or hospitals. Our priority is to save lives and minimise harm, and to ensure that staff are supported to provide safe care. We can only respond to pandemic, emergency and urgent care needs by stopping other activities. These difficult choices are being made as services and staff are stretched beyond the levels that we would normally see, even at this very challenging time of year. And as you've heard from Frank, the 4 chief medical officers have raised real concerns about the risk of the NHS becoming overwhelmed in several areas of the UK. The NHS Wales is under immense pressure, but we have made significant changes so people can continue to receive life-saving treatment. It's essential that people get emergency care if they need it, and please don't delay getting help. If you need non-urgent medical attention, please consider some of the alternative services and contact, as necessary, your GP, or perhaps call NHS 11 or other services like pharmacies. The last few weeks in particular have been extremely difficult for the NHS and for staff at all levels. I wanted to acknowledge the commitment of the health and care workforce throughout the last year. You are maintaining a response on behalf of the Welsh population despite the enormous impact of coronavirus on our system. Please, I hope we don't take advantage of their professional approach. We need to act together to control and reduce levels of coronavirus in our communities. You can help us to help you by following the rules, keeping your distance from each other, practicing good hand hygiene, working from home wherever you can, and wearing a face mask in indoor public places. If we don't do this, we may see numbers of people being admitted, which will overwhelm the NHS's ability to respond over the coming weeks. You can also help us with your choices about accessing services. Please help us to help you. Helpwch ni i'ch helpu chi. Thank you. Frank, back to you before we take some questions.
Yeah, thanks, Andrew. I just wanted to emphasise one final point, and that's the point about vaccination. You know, this week has been a good news in that we are speeding up our vaccination programme across all nations of the UK. That's with the arrival, of course, of the Astrazeneca vaccine, and that's really good news because it potentially offers us a way out of the pandemic, but it's going to take quite a while to protect everybody who needs it with the vaccines that we have available and future ones that might come on stream. And of course, the pipeline is really important on that. So as we face a different future with the prospect of vaccinations around the corner, it's really important that we still continue to meet the challenge of the virus, which is moving very quickly across the UK, partly because of the new variant that I've described. So it's more important than ever that we follow the rules and the guidance that we have in place here in Wales to keep ourselves safe. First of all, it is a legal requirement for everybody to stay home unless they have a reasonable excuse. If they have to travel to work, if they can't work at home, if they want to do essential shopping or they need to exercise. Secondly, it's really important that we don't mix. It's mixing that helps the virus to spread. So don't mix outside your households. The exemptions for that, of course, are with the support bubbles for single people, single parents that we all know about. Thirdly, it is social distancing that will keep us safe. Those messages about hands, face, safe, hands, face, space are really important, and we all need to follow that. And finally, of course, if we do develop symptoms, all of us need to self-isolate and get a test. And if we test positive or if we're a contact, we need to self-isolate. It's more important than ever that we follow these rules. We really are at a critical moment now here in Wales and across the UK. Thank you very much, Diolch yn fawr. And now we'll take questions from journalists. And of course, all our answers, as usual, will be broadcast on social media channels. Thanks.
Thank you very much. We will start this afternoon with James Crichton-Smith from ITV Wales. Good afternoon, James.
Good afternoon, thank you. Dr. Atherton, are you certain the existing vaccines work for the new variant? And if the vaccine programme takes longer to roll out fully and the virus mutates further, what are the risks of the vaccine not being effective?
So, James, thanks for that. When the new variant was first identified, there was a worry, as there was, if you remember, with the mink variation some time ago out of Denmark, that it may not be as responsive to vaccine as the original virus that came out of Wuhan. The evidence so far is that that's not a risk, that both the antibody response to the vaccines does cover both the original virus and the variant virus. And of course, there's also a T-cell immunity. So that both types of immunity, we believe, do work with the new variant as well as the original virus. What was the second part of your question, James?
It was if this virus mutates further and the rollout isn't speedy, what's the risk that almost the virus outstrips or outpaces the rollout of the vaccine?
Yeah. Thanks, James. It is an excellent question, because viruses mutate, they evolve all the time. We know they do that. This is about the long game, really. We need to think, as we get more experience with the vaccine, we will have to just watch how vaccine effectiveness changes over time, if it does change. There's always a risk that, new variants will emerge and that they'll be less susceptible to or less amenable to vaccine control. And it may be that in the fullness of time, we have to move, for example, like a flu vaccine, where we have different strains of virus being protected by different vaccines over time. But that really is for the future. The pressing need now is to deal with the virus that we know we have and to get the vaccine rolled out as quickly as we can.
Thank you. My second question probably is to you again, Dr. Atherton, which is, what's the scientific reasoning and evidence behind the decision to keep nurseries open but schools have to close? So specifically, why are nurseries seemingly safer and therefore open, and schools, including primary schools, not as safe and therefore closed?
Yeah. Well, both schools and nurseries, have made great strides in providing that coronavirus safe environment that is absolutely necessary. The issue really for nurseries is that, of course, many essential workers rely on nurseries, and if we were to close all the nurseries, then we would really have a crisis in the workforce, not just in healthcare, but in social care and beyond. So there's a fundamental issue there, and that's why, you know, across the 4 nations, by and large, nurseries are remaining open. Yeah. Thanks, James.
Okay, James, thank you very much. Moving for next question to Catrin Haf-Jones in BBC Wales. Good afternoon, Prynhawn da, Catrin.
In England, they've set a target to give all the top 4 priority groups their first dose of the vaccination by mid-February. Yesterday, Dr. Jill Richardson, who leads Wales's vaccination programme, of course, said that if the supply is forthcoming, Wales would hope to match that timescale. A question to both of you from a strategy and delivery perspective. Is that achievable in Wales as a target, vaccinating over 700,000 people in Wales by mid-February?
I'll start, Catrin, and then, Frank, I know you'll have a professional view on that as well. First of all, to say that the delivery of the Oxford Astrazeneca vaccine this week, you know, really does change our ability to now push on with volume within the system. It was only last Wednesday that we had the regulatory approval, and the first set of vaccinations with the Oxford Astrazeneca vaccine were being issued on Monday across Wales, but of course across the UK at the same time. And we will be dependent on ensuring that there are supplies in line with those broader UK commitments that we're able to discharge in Wales. But yes, our numbers will be increasing. We will see increases in activity noticeably as we go through January, and we will continue to increase those. I think we have to recognise that the NHS has never done something at this scale before. We're very experienced in delivering vaccines, you know, for a range of different reasons, for flu, for childhood vaccinations, but never to a whole population to these types of timescales. But there is a very significant commitment and ambition from the NHS to be able to step up to this, to protect the Welsh population, and of course to ensure that we can move through those cohorts as well. We are looking for some confidence and certainty about the delivery schedules and the supplies, and of course we'll liaise across the UK on that at the moment. But we will, Catrin, see increasing volumes of activity taking place, certainly as those supplies materially and visibly increase during the month of January at this stage. So we will obviously want to make sure that we're able to track those measures and find mechanisms for making sure that we can describe those, you know, more publicly. And of course, we will be able to make sure that there is a schedule of understanding about the developments here. But perhaps before I hand over to Frank, just to say, in order to really underpin the priority, the Minister and I were meeting with the National Programme Board, with all of the health organisations across Wales, who are all describing their plans for the expected increases in activity that we will want to see over the next 6 weeks or so. Frank?
Well, just to add, I mean, as Andrew says, all of our health boards are, you know, developing their plans, rolling out the plans to rapidly increase the vaccination coverage. That's being done through mass vaccination centres, through general practice surgeries, of course, and also there's discussions with community pharmacies here in Wales so that we can use that route. So we're looking at every available route, but we're going to go as fast as we can, Catrin. You know, that's the reality, but there are some constraints we have to bear in mind. We have to go fast, but we have to go safe. We have to do it as safely as we possibly can. We have to avoid wastage. You know, this is a precious commodity. We can't afford to waste it. And, you know, we always will have, for the foreseeable future, limited supply. So we will go as fast as the pipeline and the supplies allow us.
The new strain of the virus seems to be becoming quite dominant now in some parts. I suppose this is a question to both of you again. How much do we know about this new strain? Is there any data you can share with us from Wales as to whether it does lead to more hospitalisations than the previous strain? And does the new strain make it more likely that coronavirus cases could overwhelm the NHS in Wales in the next couple of weeks?
Yeah, thanks, Catrin. Is it all right if I start, Andrew? I mean, what I would say to that is that, you know, as I said earlier, there's no evidence that it's a more serious strain. People don't get, you know, a more serious type of illness. But the fact that it spreads more rapidly means that there are more people getting infected. And if you get more people infected, Catrin, you get more people in hospital and more people requiring intensive care. So that's really the dynamic that's playing out in here. In terms of the kind of Welsh statistics, obviously we're keeping an eye on that, and it varies very much across Wales, you know. So in the north at the moment, which is quite a hotspot for the new variant, we think about 70% of the cases that are proving positive are probably related to the new variant. In other parts of Wales, it's probably a bit less, but it does vary. But there is a significant amount of it. And as we've seen in London and the southeast, once it's in the population, it rapidly spreads to become the dominant strain. Thanks, Catherine.
Catherine, on the variant, and just building on what Frank has said about the prevalence up in North Wales, whilst I can't directly talk about hospital patients with the variant as such, what is clear to us in North Wales that with the growing community prevalence, it has led to an increase that is very visible in North Wales over the last 4 weeks in particular. So as an example, we now have seen the number of COVID-related patients in beds in North Wales, in hospital beds in North Wales, go up to 258. That's gone up about a third since the beginning of December. I think most noticeably in terms of pressures up in North Wales, again, not all of this will be because of the variant, but just shows how quickly things can change. The number of patients in critical care for COVID-related reasons in North Wales has actually tripled. It's gone up from 6 to 20 just over the course of the last 4 or 5 weeks or so. So things can happen very quickly. In respect of the general pressures on the NHS, and as I was saying, we are obviously managing the normal operational pressures of winter. We would not normally be responding to those pressures with 2,800 beds occupied by patients with COVID. And as I said earlier, these patients are staying longer than our typical emergency patients who will come into the system. So we are genuinely concerned about the resilience of the NHS system, but we do have plans and preparations to respond. But it comes with impact on other services and other access points for our patients in Wales. So every health board in Wales is having to make judgments on a choices framework that we have endorsed nationally to balance the emergency care alongside what they can do for planned care. But inevitably, the kind of choices they're making to prioritise COVID patients will be having an impact on other areas, for example, on waiting lists or access to diagnostic care as well. So we also have a responsibility to continue to provide those services and to make sure that patients with urgent needs get into the system. But this is going to be a very challenging and difficult period of time ahead of us, and hopefully we will see some translation of some of the reduced community rates that Frank described, translating into lower hospitalisation rates. Catherine, diolch yn fawr iawn, thank you very much. Going to move next to Mark Smith from Wales Online. Good afternoon, Mark.
Good afternoon to you both. This is more of a question directed at you, Dr. Goodall. Latest figures show that the Welsh NHS came very close to using its maximum hospital critical care capacity over Christmas, with some health boards facing no other option than to transfer very unwell patients to intensive care units many miles away from their homes where beds were vacant. Do you think this problem has been compounded by the fact Wales historically has had far fewer critical care beds per head of population than many other European countries? And do you feel that patient to bed and perhaps staff to patient ratio needs to urgently improve in Wales?
I mean, talking very generally about critical care, really important to recognise the specialist nature of the workforce that we require in those areas. And if we're developing our core bed capacity, then obviously we need to make sure that we develop and train our staff and are able to expand. And you'll be aware, Mark, of funding that has been provided even over the last couple of years to make sure that we could expand those overall bed numbers. I think what we've tried to do in the pandemic response, and this will be consistent with what colleagues across the UK have done, is whatever the core capacity is available, what opportunities do we have to actually expand beyond that safely, recognising that that will have an impact on other areas. And it provides a choice between what you can expand in terms of available beds in critical UK units themselves. So, for example, a recent advantage in the move to the Grange Hospital, that actually expanded the physical space available for those beds. But actually what we're able to do by using some of the skills, expertise and indeed clinical areas that are in other areas of hospitals of the acute hospital sites across Wales. Our numbers at the moment, I talked about the increase in the COVID-related patients, and those numbers currently stand at 140. Our actual overall numbers of patients in our critical care beds in Wales is 216. and that requires us to have extended the definition of critical care to all of those clinical areas that I've spoken about. That's why we are operating at about 140% of our occupancy. I should say that I'm really grateful, alongside all of our NHS staff, but for the particular work that our critical care staff have done in Wales, because it's been a very intense and long period of time for them, because whilst we've seen the numbers go up and down for coronavirus over the course of the last 9-10 months, their workload has been maintained at a very high level, of course, because when we've been able to bring in other patients, it means that we're dealing with other operations, patients with urgent needs who require critical care support as well. So we will want to continue with the investment and the additional capacity that we've been looking to put into critical care. I think the pandemic response has allowed us to show that we can expand those beds at this stage, but critical care will be affected, as with any other area of Wales, by workforce shortages, and there will always be things that we need to manage. The current approach across Wales would have one of our units in Wales at the highest critical care declared level. All of the other sites are very busy in dealing with expanded numbers of beds, but at least are slightly lower down on the tiered system that is in place at this stage. But if I was sharing, what are my concerns for the forthcoming weeks, it will be the fact that whilst hospital patients may be stabilising or some emerging signs of stabilisation, the numbers continue to increase on critical care, because it does represent that there are very seriously ill patients needing care within our system in Wales.
Thank you very much, Dr. Goodall. And a question for Dr. Atherton, if I may. The British Medical Association in Wales has raised concerns about the fact many frontline staff are facing a delay in getting their second dose of the Pfizer vaccine due to a change in guidance by the UK's 4 chief medical officers who want to administer as many first doses as possible to the population. The BMA believes these employees need to be given protection at the very earliest opportunity, particularly in light of the fact many thousands of workers are absent due to contracting COVID-19 or facing self-isolation. So do you share the concerns of the British Medical Association at this moment in time?
Yeah, thanks, Mark. Yeah, I've had extensive discussions with the BMA this week, and no, I don't share that concern. The decision to amend the scheduling of the vaccines across the UK was quite a tough one. But when we were presented with the information that the first dose of both the vaccines gives between 80 and 90% vaccine effectiveness, it became rapidly apparent that given the epidemiology that we've been describing, the pattern of viral transmission in the UK, it was really important to get a first dose into as many people as possible. So that's what led to the discussion, the decision, by the chief medical officers, which is really based on the advice from our independent advisory group, the Joint Committee on Vaccination and Immunisation, JCVI, and of course on the advice of the regulator, the MHRA. So I think it was the right decision given in the UK where we are in terms of our epidemiology and the absolute need to get protection to as many people as we can, including, of course, frontline healthcare workers. Because had we remained with the position of providing the 2 doses on a 3 or 4 week schedule, it would have taken much, much longer for people to get that level of protection. So we've got high levels of protection for health and social care staff going forwards. Thanks, Mark.
Okay. Mark, thank you very much. Going to move next to Dan Bevan from LBC. Good afternoon, Dan.
Thank you, Dr. Goodall, and to yourself, Dr. Atherton. Very good afternoon. This is a question for you both, if you don't mind. We've been in, effectively, lockdown for 2.5 weeks in Wales now, and we haven't seen the rates lower than what we'd previously seen, say, in the firebreak lockdown. Are you concerned by that? On this current trajectory, how much longer can, say, the health service sustain itself? And just finally, do you think that there are tougher measures that could be brought in, and what would they look like? Because at the moment, there are very few things that people in Wales can do that they couldn't do during the first lockdown.
Shall I go first now, Andrew? Yeah, thanks for that, Dan. Look, it was only on the 20th of December, of course, that we moved to the lockdown, the level 4 arrangement here in Wales. So we wouldn't expect to have seen the signal of that to date. The data has been a little bit messy over Christmas. You know, a significant number of people came forward for testing immediately before Christmas. There were fewer people actually over the Christmas period. So the data is a little bit unstable, and I think it will only be towards the end of this week and early next week that we really start to really understand the trend of what's happening. And I would fully expect that we would start to see that signal of the lockdown effect. It'll be a bit messy, of course, because we had a short period of relaxation across the four nations where people were mixing over the 2-day period. So inevitably there's been additional mixing that will have led to some viral resurgence. And so we'll have a little bit of that effect and the start of an effect around the lockdown. What I would say, is we need to really learn from the past. We did have an impact from the firebreak, as you remember, Dan, and that was not long enough lived. The firebreak was a 2-week period. The impact lasted probably about 2, 3, 4 weeks. So what we have learned is that longer periods of restriction of movements do lead to a longer term reduction in viral transmission, and so that's one of the lessons we have to take into now. That would be the kind of main measure change, I would think. Most of the things that we have in place in Wales from the 20th of December are consistent with what's happening in Scotland and in England and over in Northern Ireland. There's actually very little difference now, some marginal ones perhaps. And I think that consistency actually helps us in terms of our messaging, because we try always to try and keep messages as simple for the public as possible. And that's why I say, stay home is the most important thing. Keep your distance is really, really important.
Dan, the full national lockdown and the legal arrangements about that came into effect on the 20th, as Frank has said. And, we have seen some reduction in the community prevalence rates from the peak, Frank, I think, of around 630 that we saw in Wales on the population ratio. And those reductions, have happened without probably seeing the full impact of what a national lockdown would mean. So we do need to very closely monitor the data, as Frank said, for the rather unusual period that we've been through at this stage. Obviously, from my perspective, alongside looking at the community prevalence, I need to be able to monitor and understand how that is translating into the NHS impact in itself. So tracking on a daily basis, sometimes hourly, but certainly on the weekly trends, the way in which we're seeing the growth in the health service in Wales. Over the last week or so, we've seen some slowing down, maybe in some of the growth of patients who are ending up in our hospital areas with COVID, although it remains very busy and very challenging. But as Frank said, probably going to need to at least use the next 7 to 10 days, if not up to 2 weeks, to really see whether there is any evidence of that, stabilising the hospital outlook, which would be welcome for the way in which we need to manage our pressures for the 4 to 6 weeks ahead of us, Dan.
Thank you very much, both. And Dr. Atherton, this question is mostly based for you, but Dr. Goodall, please feel free to answer if you've got any input. We're seeing reports that travellers coming into the UK may soon have to prove that they've tested negative for the virus before they come here. But the borders have been largely open throughout the pandemic, albeit with quarantine rules for certain high-risk countries. Is the mandatory testing the mandatory testing negative something that you and other CMOs have recommended to the UK nations previously? And if not, why is that the case?
Yeah, the whole process of border controls is under review, Dan, I would say. And there was a call between ministers earlier this week where Michael Gove, talked about a UK-wide review, and I think everybody is committed to look at that again. What I could say is that, given the current level of viral transmission here in Wales, the amount of imported virus is probably quite small compared to what is being transmitted here in Wales. As the numbers come down in future, then the possibility of importing viruses becomes more important. So it's a good time to look at that again, really. Thanks, Dan.
Dan, thank you very much. I'm going to move for the next question to Andy Davis from Channel 4. Good afternoon, Andy.
Good afternoon, thank you. First question to Dr. Atherton, please. You've spoken specifically about the role of the new variant in North Wales. How concerned are you that rates in parts of North Wales continue to rise despite Wales being in a lockdown and despite schools being closed, which does appear to be a different pattern to elsewhere in Wales. Is it possible that the current restrictions just aren't enough to keep numbers under control? And have you had any discussions about whether you need to take further steps?
Yeah, so the picture in North Wales is, complicated, Andy, as ever. One of the things which, we have seen, of course, is that when the virus kind of resurged in late November, early December, it was predominantly in South Wales and South East Wales in particular. And then it kind of moved, into North Wales, and so there may be a time lag effect that we're seeing. That's an additional thing. I think there is an impact of the new variant. I believe it's more prevalent in North Wales. We're still looking at unpicking all the data around that. But as I said earlier, about 70% of the isolates at the moment in North Wales are likely to be the new variant, and it's lower, we think, in other parts of Wales. So those two factors, combine, I think, to give the differential picture that we're seeing in North Wales. As to the question of, what other measures, it's back to the point about, the lockdown measures have only been in place since the 20th of December. We know from previous experience, from the firebreak indeed, and before that, of course, the March lockdown across the UK, that those measures are effective. If people do not come into close contact, they cannot spread the virus. Let's put it that way.
Thank you. When you and other CMOs said on Monday that there was a material risk of the NHS being overwhelmed over the next 21 days in several areas of the UK, was Wales one of the areas being referred to, Dr. Atherton, and to Dr. Goodall? What could that mean for patients if the NHS in Wales is overwhelmed? What could that look like? Would it mean rationing of treatment in intensive care settings, for instance?
To my part of the question, Andy, the answer is yes. The southeast of London, east of England, the southeast of England, London, and the east of England, are particular hotspots. But South Wales as well was an area of considerable concern, and still is.
I mean, Andy, we've always tried to ensure that we have a way of operationally responding to the pressures, whatever is coming through the front door, in order to be able to protect the Welsh population. But obviously, the more we have COVID dominating our hospital and system environment, right through from the ambulance call through to those patients in hospital beds, the more it inevitably has a knock-on effect. And of course, there are many other settings and services that are operating which are outside of that hospital environment that we have to rely on. So my concern, at this stage is, as I said in my introduction, over a third of our beds, of our occupied beds, are with COVID patients. We have some individual health board areas that are approaching 50% of their beds being taken up by this. We had anticipated this in December, and that's why we had endorsed a choices framework in Wales. That means that organisations were able to make choices about the range of activities that they could provide to secure safe staffing, to be able to distribute staff and resources from other areas, to reprioritise those staff that may be needed to allow some of the expansion into critical care. And I think those plans, whilst they have a knock-on effect, have actually worked with some of the resilience of our system at this stage, but inevitably it comes at a cost. And we've been constantly tracking through the pandemic response and experience the impact on other services, the level of referrals coming into the system, the number of patients coming through A&E, the number of cancer referrals that we have. So I think we just need to continue to monitor those issues coming forward. I mean, the Minister's been really clear with myself and with the system in Wales that if there is a need for us to step into national directions that are similar to what we needed to do back in March and April, that we would do so. But that has not been the advice to date that has come from the NHS at this stage. So we'll monitor it really carefully and closely over the course of the next few weeks or so. But it is a very difficult and challenging environment for our NHS and our social care staff at the moment, given the pressures that we're responding to because of winter, but also because, of course, of the COVID experience. Okay, thank you very much, Andy. I'll move on now to the next question, which is Branwen Jones from S4C. Prynhawn da, Branwen.
Prynhawn da. This question could possibly be for both of you. A handful of people we have spoken to have told us that their loved ones who are over 80 years old have yet to be contacted about a vaccine or receive any information on when they'll be vaccinated. Can you explain why that is and how long must these people wait?
Frank, I'll start. If you want to come in, please let me know. Of course, as I was saying earlier, the logistics of what we're doing at the moment is on a scale that we have never undertaken before in the NHS, either in Wales or across the UK. Events move on very quickly. It was only last Wednesday that we had the regulatory approval to be able to use the Oxford Astrazeneca vaccine, as I was saying earlier, and we were able within 5 days to have the start of patients and staff being vaccinated using that vaccine. You're aware that through December we've been able to use the Pfizer vaccine and have had certain volumes of those coming in, but you'll also be aware about some of the constraints on the ability to use that in a lot of our normal settings, just simply because of some of the specialist refrigeration that's required around that. So we have deliberately tried to focus on mass vaccination centres for that stage with some support and an ability to at least go out into some of our care homes in Wales. But the availability of the Oxford vaccine this week just changes the dynamics of the way in which the system operates. It normalises that we can use our normal practitioners in their normal contacts who will be doing this, whether that's in a pharmacy, in a GP surgery, and that's where we will be able to make the most progress in hitting those early cohorts that have been declared by JCVI, including the over 80s at this stage. From a planning perspective, we've been operating a week in advance of the availability of supplies, and what we're hoping to do now with greater certainty is if we can start being aware of the supplies for the next 2, 3, 4 weeks, we will be able to revert more to an appointment-based system. That means that we'll be very clearly working our way through some of those categories. But I am aware, although clearly there will be individuals not accessing at the moment, there is a much higher volume of over 80s that are now coming through our system, and that, I think that will change very visibly over the course of the next 2 weeks, Branwen.
Thank you, Diolch. And my second question to Dr. Atherton. With the Oxford Astrazeneca vaccine being carried out for the first time in Wales this week, does the Welsh Government plan to publish the number of people vaccinated each day?
Yeah, there's an active discussion about how we the periodicity that we use to give that information, whether it's on a daily or a weekly basis. There's a meeting actually this afternoon to kind of look at that, and we'll need to also look at what Scotland, what England, and what Northern Ireland are doing. So we'll just defer a decision on that, but we'll let you know that as soon as possible.
Okay, diolch yn fawr iawn. Thank you, Branwen. Going to move next to Steve Bagnall from the Daily Post. Good afternoon, Steve.
Good afternoon, Dr. Goodall and Dr. Atherton. Probably for the two of you this one. You've talked about the rise in North Wales and particularly in Wrexham and Flintshire about the virus. We do have the new, more infectious variant, but are there any other reasons you may be aware of why it's spreading quicker compared to, say, North West Wales? Is it simply the new, more infectious strain arrived in North East Wales first and has become more prevalent? Or are there other factors such as a denser population or larger industrial areas where people have to go to work that can lead to more mixing and drive the virus?
Yeah, it'd be partly speculative, Steve, but I would think it's around population density, to be honest. And we saw earlier in the pandemic, a significant uptick in infections before we had the variant in Wrexham, if you'll recall, and that did lead to quite a lot of concern around there. There are kind of issues around borders and border with England. What we saw in the first wave was infection kind of moving from east to west, and there may be a bit of that so it does tend to move east to west from south to north, and that's the pattern we're seeing probably in this second wave, the same as we saw in the first wave. Yeah, but that's somewhat speculative, but that's what I think is happening.
Yeah, I mean, I think I would just say, Steve, really important that we continue to ask the public to work with us, alongside us, to help us protect the NHS with their choices and making sure that by complying with the guidance, they are limiting their interactions, that they are following all of the things that we've both tried to describe this afternoon. It's that actually improves our effectiveness in our response. The NHS will respond on the one hand, but as happened during the first wave, we really need the public to be with us in the ability to stop the transmission of this virus.
Thank you. And obviously there's been some concerns raised about North Wales lagging behind with distributing the vaccine. What reassurances can you give that Wales regions will be getting their fair share of the vaccine and people will be getting vaccinated as soon as possible?
Yeah, I mean, alongside the Welsh population share, which has been part of the conversations and agreements that we've had in place with UK government, I mean, clearly we expect all of the vaccinations to be distributed and to be implemented on a population share across Wales. So North Wales will have its respective population share, as will all of the other health board areas of Wales at this stage. I've had contact myself with the Minister, as I was describing earlier, with all of the health organisations in Wales this week, and it was really clear to me that I was able to see evidence of the expansion plans for Gyda, how they were looking to expand. As I said earlier, Steve, the availability of the Oxford vaccine to be able to be used in more normal settings like pharmacies and GP practices just completely changes the way we can deliver this and make sure it is much more accessible, particularly for the vulnerable groups. And I'm sure that will be the case in North Wales. I understand that there is a very high level of commitment from GPs in North Wales to want to be part of the vaccine distribution and the rollout to make sure that the North Wales population are protected. Steve, thank you very much. And just as our final questions for this afternoon, just now moving to Iolo Jones from Golwg 360. Prynhawn da, Iolo?
Prynhawn da to you both. I'll be asking my questions in both Welsh and English. My first question is similar to one of Mark's questions, but I'll direct mine towards you, Dr Goodall. Yn siarad y Golwg yr wythnos hon, nath Dr Phil White cadeirydd Pwyllgor Meddygol Teulu Cymru godi pryderon ynghylch yr raglen brechu, y brif bryder yw hyd y bwlch rhwng y dwsys. Mae'n derbyn bod y gap yn ddiogel i'r cyhoedd, ond mae'n teimlo y dylai staff rhain flan derbyn dwsys yn gynt. Mae staff rhain flan yn dod wyneb i wyneb yr feirws o hyd ac mae'n gofidio nad yw un dos yn mynd i ddarparu mewnedd digonol. A chythau'n brif weithredwr ar Gig Cymru ydych yn rannu'r pryderon yma. And then, speaking to Goodall this week, Dr Phil White, Chair of the BMA's Welsh GPs Committee, has raised concerns about the vaccine rollout. His main concern is the length of the gap between the vaccine doses, 12 weeks of course. He accepts that such a gap may be safe for the general public, but feels that frontline medical staff should receive their doses sooner. Frontline staff are in regular contact with the virus, and he argues that a single dose might not provide the level of immunity that they require. As Chief Executive of NHS Wales, do you share these concerns?
I mean, Iolo, I suggest really that I ask Frank to answer in the first instance, given the professional basis of the question. And, you know, Frank, you've obviously been involved with other CMOs in the network and the agreements over this last week.
So, Iolo, yeah, so I disagree, you know, with Bill on this one. And the BMA, you know, I think are, you know, mistaken in thinking that it is inappropriate to vaccinate as many people in Wales as we possibly can. You know, if we were to not have moved to the extended vaccine schedule, it would have delayed the first dose of vaccine being administered to healthcare staff, to social care staff, and of course to the general public. And in that time, you know, people would become infected, people would be hospitalised, and people ultimately, sadly, would die. So it was based on a decision, based on this, a really clear prediction that there would be more harm by sticking to the schedule than by extending the schedule. Of course, the second dose is really important, and it has to be administered. But we believe, from the data that's been made available, that it can be done safely and effectively over an extended period.
I mean, just to speak generally, Iolo, you know, in my NHS Wales Chief Executive role, you know, we do have a concern at the moment about seeing high levels of sickness and absence across Wales. You know, currently our levels are as high as 10% at this stage. About 4.5% of that will be because people are off for reasons of COVID, but also because of reasons of self-isolation with contact tracing or family environments, etc., that are happening at this stage. And it's really important, therefore, that we are, you know, supporting staff and their well-being in these very difficult environments. But, you know, we do need to make sure that there is a real commitment to deal with the focus on healthcare and social care staff across Wales in the JCVI criteria. And again, as part of the discussions that were taking place with health boards this week about how they were approaching that, we could actually see that there was already visible progress that we were going to be expecting through this week and into next week about completing some of the individual staff cohorts that we've been expecting as well. So I hope the speed of the rollout, as in the manner that Frank has described, will actually help give some confidence about where we go next with the vaccination rollout for our staff in Wales.
There we go. And just as to my second question, mae'r Cydwadwyr Cymreig yn galw am flaenoriaethu y thrawon oddi fewn i'r raglen frechu ac yn dadlefnu galwad wedi cael ei atgyfnerthu gan gyhoeddiad diweddar Christy Williams am ysgolion a symud at cadw at wersi ar-lein. Beth ydych chi'n meddwl o'r ddadl yma, a dylai athrawon gael eu blaenoreithio fewn y raglen frechu? The Welsh Conservatives are calling for teachers to be prioritised within the vaccine programme. They argue that their call has been strengthened by Kirsty Williams' recent announcement in schools and sticking to online teaching for the time being. What do you think of this argument? Should teachers be prioritised within the vaccine programme? Should they be on par with frontline workers even?
Shall I answer that, Andrew? So we've looked at this, in Wales, and we've looked at it, in conjunction with other CMOs across the 4 nations, and we all, recognise that, a commitment to keep schools open is really important for children, for young people, and for their futures. However, teachers as a group have done a great job of trying to create COVID-secure environments, and that needs to continue. Teachers themselves are not at any greatly higher risk than the general population or than some other professions in terms of hospitalisation and poor adverse effects from coronavirus. So, in my opinion, it would be a mistake to raise them up the priority groupings. And the reason for that, Yolo, is that if you raise somebody up the rankings, you have to drop somebody down. Who would you drop down? Would you drop down the over 80s? Would you drop down the clinically extremely vulnerable? Would you drop down health and social care workers who have much higher risks? And I think, any rational person who was asked that question would answer, no, you shouldn't do that. So there is a commitment here in Wales to stick with the JCVI, the Joint Committee on Vaccination and Immunisation, their prioritisation schedule. We will, as Chief Medical Officers, be asking them to keep that under review. So if new evidence comes to light, we can look to them to update the prioritisation list. But at the moment, there's a deep commitment here in Wales to stick with those priority groups.
Iolo, diolch, thank you. That's the final set of questions for this afternoon. Thank you for those questions, and thank you for joining us this afternoon. Diolch yn fawr iawn.